Hello, your podiatrist has examined you and has found that you have an Achilles tendinopathy. Your Achilles tendon is a band of fibrous tissue that connects your calf muscles to your heel bone. If the tendon becomes damaged or inflamed, it can become very painful. This condition is called Achilles tendinopathy. There are two main reasons that you may develop Achilles tendinopathy. It is either because you are putting pressure on the tendon as you walk, or the tendon itself is weak. Strengthening the tendon is the best way to treat Achilles tendinopathy. Sometimes you will also need an insole for your shoes. Most people will need a combination of both. This video will show you some exercises to help strengthen the Achilles tendon in one or both of your legs. These exercises are likely to cause some discomfort, but we know that if you do them regularly, they will improve your symptoms. However, if you have concerns about the pain or how to do the exercises, please speak to your podiatrist. The easiest and simplest way to strengthen your calf muscles is to do heel raises, which involve pushing up onto your toes. To begin with, you should do this while sat in a chair. From a sitting position, slowly raise both heels off the ground at the same time so that you are on tiptoes. Hold this position for 2 seconds and then slowly lower your heels to the ground. Repeat this 10 times. After a short break, do another 10 heel raises and then another 10, so that in total you do 3 sets of 10 heel raises. Once you can comfortably perform heel raises while sitting down, you can now try it from a standing position. To begin with, you may want to hold on to a chair for support. As before, slowly raise both heels off the floor at the same time, hold the position for 2 seconds, and then slowly lower your heels back down to the ground. Repeat this 10 times. After a short break, do another 10 heel raises and then another 10. So that in total you do 3 sets of 10 heel raises. You can now move on to eccentric training. Eccentric training means working with your muscles as they stretch. This has the benefit of developing stronger muscles and allowing faster healing, which is important in the recovery of your Achilles tendinopathy. The following exercises should be done over a 12-week period, and you need to do them twice a day, every day. To begin, stand on the step with your heels hanging over the back of the step. You may need to hold the handrails for support. Take the injured leg off the step, as shown by the ribbon, and perform a heel raise using the non-injured leg. Place the ball of the foot of the injured leg next to your other foot on the step, so that you are standing on tiptoes. Lift the non-injured leg off the step, so that you are now only supporting yourself on your injured leg. Very slowly and carefully lower yourself down until the heel of your injured leg is below the level of the step. You must have full control of this movement, because it is this part of the sequence that works your injured Achilles tendon. Repeat this exercise 15 times and then take a short break. We recommend you do another 15 and then another 15, so that in total you are doing 3 sets of 15 repetitions. Now try the same exercise with your knees bent. This will strengthen a more specific part of your Achilles tendon. As you become confident with this exercise, you need to increase the pressure that you are putting on your Achilles tendon. To do this, put on a backpack and slowly increase the weight of the bag by adding bags of sugar or cans of beans. If you have any questions, please speak to your podiatrist.